conversion brief, we have cancer epidemic. And the defense team remains the same. I think that will be joined by the moderator. All the 5 accused persons are present in court, with everyone appearing from 0 women prisons, and the 4 peaceful attendants in court. The assessors are also in court, and we are ready to continue with the defense hearing of this matter.
If it pleases my lord, for the record, Ellison Karahanga. My lord, we have a witness in court, but the witness requests that because of his, he deals with very many people, that his image and name do not enter the media. Doesn't mind his testimony going in, but just his image and his name.
Media, the name and the
face.
image.
The face.
The witness coming not to be recorded.
Yes. This media man. The face
The man.
He has just arrived, my lord. He may not have had the order.
Next witness has requested that for witness protection purposes, his image and his name not to be recorded. So you can put DW3 XXX. It's your purpose.
Most obliged, my lord.
Before this honorable court.
Touching the matter before court.
Touching the matter before court.
Is the truth.
Is the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
Okay. Doctor, kindly tell this court your full names.
I'm called Dr. Sechimpi Patrick.
And doctor, what do you do for a living?
I am an orthopedic surgeon who specialized specifically in trauma orthopedics from South Africa. And my first degree in Masters of Orthopedics.
Maybe if we just go slow.
Okay.
So you are an orthopedic surgeon?
Yes.
Who specialized in trauma?
Trauma, yeah.
In trauma what?
Orthopedics.
In trauma orthopedics?
Yes.
Yes, and then you were...
So
yes.
I qualified from Makerere University for my first degree and my Masters of Orthopedics.
So what is the degree that you qualified in? What's the first
MBCHB.
degree? So that's
MBCHB.
MBCHB. Is that medicine?
Bachelor of Medicine and Surgery from Makerere University. And then I did a master's.
When did you graduate, sorry?
That was 1996.
1996.
Yeah.
Okay. Then after that you did a master's, you said?
Masters of Orthopedics at Makerere University.
A master's in what?
In orthopedics.
In
at Makerere
orthopedics?
University.
Okay.
Yeah.
Any other academic
And I qualified in 2003.
Which, 2003?
Yes. And I straight went for a fellowship in South Africa, KwaZulu-Natal University. And I got a trauma fellowship there. And David sat the...
Sorry, just tell us the university again, KwaZulu?
KwaZulu-Natal.
Natal.
Yeah.
And you got a fellowship there in what?
Yeah. Trauma.
And then you say you sat what?
Then I sat the council exams in South Africa. The higher diploma exams in South Africa, which permit me to work in their public institutions as an orthopedic surgeon. And the same year, and then I returned
You didn't get that medal.
Pardon?
Higher diploma exams.
Higher diploma exams in South Africa, which permit me to work, but I didn't work. I came back to work to serve the country.
Permit you to work as a what?
It permits me to work there if I wanted,
As an orthopedic.
as an orthopedic surgeon. Yeah. But I returned because of my family to work here.
So, doctor, just so we are clear, can you just tell us all these qualifications? What are they? If you just narrate them again. Bachelor of something, master's.
Okay.
Yes.
Bachelor of Medicine and Surgery. You are permitted to work as a medical officer, which I did for those years. Then I returned to Makerere and I studied for a master's in orthopedics, and I qualified in 2003. And then I went for a fellowship in trauma in South Africa, and I qualified. And I also sat there fellowship exams for the higher diploma, okay, in orthopedics. And then I returned to Uganda to work.
Okay. And when did you return?
I returned at the end of 2004.
And what do you currently do? What's your work that you return to?
I am an orthopedic surgeon, and at the same time, I do medical training of orthopedic surgeons at Makerere University as a senior lecturer and head of department of orthopedics.
Sorry, let's just go slow. At the same time?
I do training in medicine in the field of orthopedics, and I'm the current head of department orthopedics. My private practice.
So before you reach your private practice, you're the head of department where?
Yeah, at Makerere University.
This is in which college, in which school?
The College of Health Sciences and School of Medicine.
And do you do any work in a public hospital?
The public hospital where we do training is Mulago National Referral Hospital. And that's where my offices are. So we do 3 activities there. We treat patients, and then we do research, and then we do training of the future orthopedic surgeons and other categories of doctors.
So are you a head of department there? Where are you?
Yes, I'm head of department.
I know can our colleague leave the witness without leaving it.
Okay. So you are saying?
So I've said I work at Makerere University as head of department of orthopedics,
Yes.
as an orthopedic surgeon.
Yes.
And we do 3 activities. We do training of orthopedic surgeons, research, and we participate in the clinical service delivery. In other words, operations and clinics and everything that is done. And then at the same time,
Yes.
I do some private practice. And I've been doing this at International Hospital, which we now became Care at Namuwongo.
What do you do there?
I run clinics, and when there are emergencies or operations to be done in the field which I specialized in, I do them. That's orthopedics. Yes, I run clinics. Running clinics means you see patients on a designated time, on appointment.
But may the witness be reminded that we need to write.
Yes.
We need to write.
When you need clarification, I'm going to give it to you.
We are just requesting that you speak at Penny's speed.
A slow speed, okay. So I conduct clinics for orthopedic patients, and I carry out ward rounds for the patients that have been admitted according to the duty roster, and I conduct operations, okay, when I'm called upon to conduct the operations in that institution.
Okay. And maybe lastly on the introduction, you said at Makerere you do treatment, teaching, and research. What, if any, research have you been involved in yourself?
I do research in the area of specialty of orthopedics, and I supervise my students' research before they qualify for Masters of Orthopedics. And I've been publishing. So I don't know what more you want to know in that field.
Doctor, very briefly, can you help us to understand what you mean by orthopedics?
All right. Orthopedics is a field of medicine that takes care of ailments in the musculoskeletal system of the body. And the musculoskeletal
It's
system
a field of medicine that does what, sorry?
that takes care
Yes.
of ailments in the musculoskeletal system.
How do they spell that in that?
Muscular, like musculo, you just remove the AR of muscular,
Okay.
put O,
Okay.
and then skeletal, musculoskeletal system. We take care of elements in that system, which involves bones,
Involves what?
bones,
Bones.
joints, all right, and the soft tissues that assist locomotion of the joints. And those soft tissues
Sorry?
mainly
Just slow down. The soft tissues that assist in the locomotion of what?
locomotion of the body, all right? Okay. So if I can enlist them if you need, they are mainly tendons, ligaments, and other soft tissues. But that's basically the area where we work.
Okay. Doctor, do you know Mole Katanga?
Yes, I know her.
Can you see her in this court?
I think I can identify her from the eyes because I took some time to treat her on the screen.
Okay. She's the person on the screen. Maybe she can remove her
Maybe
mask.
she can move the mask and I confirm that. Yeah. All right.
It's just, you need to say it so we can record. Can you?
Yeah, she's the person.
She's the person.
On the screen.
Can you tell this court how you came to know Mrs. Katanga?
On the morning, it was early morning because I used to go very early in that year. That is 2003. It was the second day of November 2003. I'd gone to run my usual, or to conduct my usual activities of the clinic. And then because the hospital knew that I'm usually in hospital before 7 o'clock, they contacted...
Sorry, just confirm the year. What year was that?
It was 2023.
Okay.
I'm sorry about that. 2023. Okay.
Okay.
Yeah. And because they know my schedule, they told me that there was an emergency case in the emergency area of the hospital that needed my urgent attention.
Who told you?
The hospital, through the system of the hospital. I was informed that before I start the clinic, I should go and see that patient. So I went to the emergency section to see the patient, and I found the client on the screen. And the reason why I was told to go and attend to her is that she had injuries. Now, when I found... Yes, am I so fast?
Yes, you are.
Yes, okay. I'll stop. You tell me to continue when...
Maybe before you continue, my lord, we can take a interpretation. Doctor, we interpret in Rutoro for one of our people, so one of the accused.
...2023.
Okay, now maybe you can describe for us what you saw. When you saw her, what did you observe?
She had heavy bandage on her head, and then she was being taken care of by a neurosurgeon.
Just slow down. Being taken care of by
A neurosurgeon. All right?
Okay.
Okay. And my area that I was called to assess was the limbs, the upper limbs.
You were called to assess which part, sorry?
The upper limbs.
And in simple layman's language, what are the upper limbs?
These are the hands and the forearms and then the hands. Hands, forearm, and the arms. Those are the upper. Those comprise the upper limb of a person.
The hands, the forearm, and the
arm.
And the arm.
Yeah. Can I explain what I mean?
Please do.
So the hand is this part, all right?
Which
finger,
part? 'Cause we're
yes,
writing?
it has
The hand
this
has.
part and the fingers.
No, please tell us the part. Which part is that?
This is the hand, all right?
That's the palm.
Which has the palm and the fingers, all right?
The hand has the palm and the
Yes.
fingers. Okay.
And then you have the forearm, which goes right from the wrist down to the elbow.
Sorry, just slow down. The forearm goes from where?
From the wrist to the elbow.
Okay.
And then the arm is the part above the elbow to the shoulder.
Okay. And then what did you observe?
So,
About her
yes,
upper limbs?
the upper limbs, she had the following injuries I'm going to state. In the area of the fingers, hand, wrist area, and the forearm.
So she had injuries in the fingers,
Okay, on the fingers,
the wrist,
the palm, the wrist, and
wrist,
the forearm.
and
On both sides.
On both sides.
Yes.
Now, doctor, we'll get into the injuries shortly.
Okay.
So what did you do after you assessed that? What do you mean by both sides, sorry?
On both the left and the right
Those are the hands.
of the yeah.
And did you observe any other injuries on her body?
I said she had a heavy bandage on the scalp. of the head.
Okay, and now, doctor, so after you... Doctor, so after you assess her with the injuries, what did you do?
So we agreed with my colleague that the patient should, as urgently as possible, be taken to theater for management of the injuries that she had. And
Sorry? Just name the colleague. What's the name of your colleague?
it's been a while, but I think is Onen. I think the name should be Onen. I mean, the hospital probably should have that exact detail of both names and whatever.
Okay. So you agree with Dr. Onen. What did you agree with the doctor?
So we agreed that the patient, as urgently as possible, when theater is available, should be taken to theater, and we work on the different parts.
Should be taken to theater, and you work
Theatre.
on the...
on the parts, on the injuries that she had.
Okay. Was there an order in which you would work on her?
Because of the urgency of the bleeding on the scalp that I came to understand, and the brain, I mean, that bleeding is the most urgent issue that should be
This is bleeding on the what? Sorry.
on the scalp.
On the scalp.
Yeah, because that's why it was heavily bandaged.
Okay.
So the first part was for him to arrest the bleeding from the scalp, and then stitch those wounds, and then I come in to perform the procedure on the upper limbs. I'm using upper limbs because I cannot be repeating all the parts every time I speak. Yeah.
That's okay. Now, and so can you tell this court about the surgery you performed?
You don't want to know about the diagnosis I made before I go to the surgery?
Fine, please tell us the
They already
diagnosis.
find the injuries clearly. Now, in medicine, for us to come to a conclusion of what injuries the patient has got, we use, we inspect, we palpate.
You inspect, please speak slowly.
Inspect.
You
right?
inspect, then you palpate.
Then we palpate.
How do they spell that?
Palpate is P-A-L,
Okay.
P-A-T-E.
Yes.
In other words, you touch to see tenderness where it's tender and that kind of thing, where possible.
Okay.
Sometimes we don't want to do it because it causes pain on the patient.
Okay.
And then after assessing, we usually do X-rays
Okay.
to see the bones, the status of the bones and the joints.
Okay.
Yes. So, and that process, we can start from the emergency up to the theater, because in theater you open again the limbs and see things more clearly. So, and these are the injuries that I found out after all those
Okay, just slow down.
processes.
You start from the emergency, you said, up to theater.
Yeah, you can see what you can see in emergency, because sometimes you don't have to cause pain to the patient or that kind of thing. But when you reach theater and she's been put under sleep, then you even look more, because now you take off everything and you can see the injuries even more clearly.
Okay. So just hold on. Let's record that. Just hold on, doctor.
Yeah.
So in theater, she is put under what?
Under
Sleep.
anesthesia.
Under anesthesia.
Yeah, you told me to be a bit simple, so
Yes. Under anesthesia, which means sleep.
sleep, yeah.
And then you can see the injuries. What?
Yes, a
You
little
said
bit
something.
more clearly, because now you take off the dressing in preparation for the procedure.
Okay, just.
I'm a little bit confused. Is it giving us hypothetical scenarios, or is telling court what he did? We are failing to differentiate.
I'm telling you what I did and how I make my decisions as a professional. So in this case, so what I did is, let me tell you what I did, because I first explained why I did it.
Yes.
All right?
It's okay, doctor.
Yeah. So I explain what I did.
So just to be clear, no, before that, just to be clear, before that, you have explained to us what happens in an ordinary patient from the time from emergency to theater.
To theater, yes.
Now, in this particular case?
In this particular case, so I found the patient with dressings on the upper limb, okay? And then I had to first assess, because she had pain, I had to look at the x-rays,
So
right?
Because you looked at the x-rays?
Yes, to make sure that I don't cause some more stress and pain. So the x-rays revealed the injuries that she had, and because she had dressings and they were a little bit soiled, I needed to do more assessment in theater.
So by dressing, can you explain?
Yeah. Yeah, I slow down?
You want to look at the x-rays?
Yes.
So that to ensure
Yes,
that you don't cause harm.
Yes, yes.
Then you?
Then of course we agreed that the injuries she had and the dressings, meaning that there's a possibility of open injuries, we take her to theater and assess those injuries more, and then I do the procedures I had to do on the limbs. After my colleague had stitched the scalp.
And as you do this, as you did that, did you make any note, any clinical notes? Do you write on anything?
Yes, we write notes at the end of the procedure. We call them theater notes.
Doctor, if I showed you your theater notes, would you be able to identify them?
Yes, I know my handwriting.
My lord, if this is the perioperative record for the Okay, doctor. Do you see the notes that you made?
Yes.
Where would you find them?
They're at the end of that pamphlet. The very last. Can you hear me?
No. Maybe my lord, you can be translating. Notes?
Yes, I identified my notes.
Okay. And what shows that they are yours?
The signature, the handwriting.
And is there, what page are they on?
Page 15. Because my colleague had written on page 15.
And this document, what do you call this document?
Data notes. So data notes, you can see on page 8 and 9, we have the anesthesia report. The patient was in theater being worked on, page 8 and 9. And then we perform the procedures, and the one who does the procedure first writes the notes. And because his procedure writes also treatment.
My lord,
Slow down.
we may be technically constrained. Will the doctor, my lord, restrict himself to what he did, as opposed to what other people did?
My lord, I think he's just explained to us the document.
My lord, he can't be explaining to court what other people did.
He's just, I think he's just leading us to his.
I was just leading.
Tell us what he did.
I'm going to tell you what I did. So after my colleague had done his part,
Yes.
and I was in the theater, and he had stitched all the lacerations in the skull, I now was supposed to handle the injuries that I formed from my assessment. And these are the injuries I want to describe before this court.
Wait, before that, we shall come to the injuries. Are they detailed on your clinical notes?
I mean, I hear I'm writing just the things I did.
In the theater?
In the theater, yes.
So just hold on, just stop there. So your clinical notes, the theater notes do what? You're just writing what?
On the procedure I did, right?
Okay. And doctor, I'll come to that, don't worry. I'm just first establishing
What I did, all right?
a scheme, and then I will come to the injuries. So, apart from treating her in theater, did you have any other interactions with Mrs. Katanga?
Yes. When I finished treating her in theater, I followed her up on the ward for several occasions to make sure that the injuries are healing. And I interacted with her during that process.
Regarding the following up with her, apart from Mrs. Katanga, tell us if there were any other people who you interacted with regarding her care.
I remember one relative.
Okay, so you interacted with her relatives?
Yes, I was in touch with one relative.
Okay.
A gentleman called Mr. Kamu.
Okay, apart from Kamuntu, is there any other person you...
No, that's the one I interacted with as caretaker.
Okay, apart, outside of her family, did you interact with any other organized...
I
Okay.
just did my professional
My lord, at the theatre, outside the theatre, I missed the last.
Outside.
That is in the ward.
Regarding her,
In the ward.
regarding her care, I interacted with one relative at Itoma called Mr. Kamuntu. I
Okay.
did not interact with any
Any
other.
other members?
So, tell us.
The interaction with the relative was after the theatre.
After the theatre.
Okay, tell us tell us what, if any, contacts you had with the police.
The contact I had with the police was that I noticed that the patient had a security group at her entrance, and every time you come to do a ward round, they would make you sign the book. And then I enter, I see the patient, and then I get up. That is one contact. Then the second contact I had with the police. Yeah.
And that was the police.
Yeah, it was
No, my
it was
lord.
police.
No, my lord.
Yes.
Okay, who was that?
My lord,
Just a
my
moment.
lord, my
The
lord.
patient had a security.
The security, yes. The police security. All right? At our entrance.
Had security detail at the
Entrance,
entrance.
yes. And I had to, you go through it to go and want to see her.
This is when she was in the ward.
When she was in the ward, yes. That's one contact. Then the second contact I had with police is with the police surgeon called Mr. Moses Yarhanga.
Okay, just slow down with
Dr. Moses Yarhanga,
Okay.
who came to assess the injuries and requested the medical team, including me, to give the reports of what we saw and what we did.
So you gave a report to him.
Yes, I gave the report to him.
My lord, may we request, my lord, that the defense refrains from leading? We believe they can get all materials from this witness.
Much obliged, my lord.
My lord.
Much obliged, my lord. Who did you give the report to?
The report was given to Dr. Moses Yarhanga on his request.
If that report is shown to you, can you identify it?
Yes, I can identify the report.
My lord, we pray that the witness be given prosecution exhibit 121.
No, my lord, how?
Is that the report?
No, my lord, we can't even go there. Counsel is asking, can you identify it? He simply says, I can. Then he wants court to hand over the document. He has a duty to tell this court
Which
how
report?
how
Which
he
report
can
are we
identify
talking about?
exactly which
Are we
report
talking about
and how.
The report to Dr.
My
Biarhanga.
lord is testifying. He's testifying, my lord.
Which report?
Let
My lord, the witness spoke about he wrote a report to Dr. Biarhanga. I asked the witness, yes. And I asked the witness if the report is shown to him, can he identify it? He has said yes. And I've asked the court to give the witness prosecution
My lord,
exhibit.
that is not enough in exam in chief. If a witness says he can identify a report, let him first tell this court how he can identify that report before the report is put to him. That is how it goes, my lord.
My lord, can I have prosecution exhibit 121? So, my lord, the witness has maybe already testified that he wrote a report.
Yes, he said that you are requested to give reports of what we saw and
Yes, in writing to Dr. Biarhanga. Yes.
then you ask if that report is given to you.
Can you identify it?
Identify that report and you say yes.
Yes. So, my lord, I want to now give him the report to see if he can identify it.
How will we be able to identify?
How will you be able to identify the report?
I signed the report.
Okay? So if I give it to you, will you be able to identify it?
Yeah.
Your signature on it?
Yes.
My lord, can the witness be given prosecution exhibit 121?
My lord, can we look at it?
Maybe, my lord, we could be taking a translation.
As I wrote at that time.
He signed it, and these are the things he wrote at that time. Now, doctor, very briefly, I want you to take this court through that report.
Okay.
I want you to read and explain, and I'll tell you wherever to explain. So,
Okay.
start with re.
Re Miss KATANGA orthopedic report.
Okay. What's the date?
13th November 2023.
So it is Miss KATANGA orthopedic report dated 13th November 2023.
Yes.
Who is it addressed to?
It was addressed to the Director, Health Services, Uganda Police.
Okay. Just read for us very slowly the first two paragraphs.
Okay. The above named presented to the Accident and Emergency Unit with scalp bleeding and laceration.
It's presented to the Accident and Emergency Unit.
With scalp bleeding, coma,
Yes.
lacerations.
Yes.
Does anybody need to understand the lacerations? Okay,
No.
wonderful. Painful wrists and hands following domestic violence.
Following
Domestic violence.
domestic violence.
Yes.
And then the next sentence.
And these are the orthopedic injuries sustained.
So now, So, doctor, before you go into it, can you explain? These are the orthopedic injuries sustained by the
patient.
when?
On the 2nd of November 2023, when I saw her.
And just to refresh my memory, you explained to us orthopedic medicine. Maybe in just a sentence, just tell us what
I
are
said
orthopedic
orthopedic
injuries.
medicine deals with the musculoskeletal injuries. In other words, the soft tissue surrounding bone and the bone injuries and the joints, and all those diseases that affect those parts of the body, right from the neck down to the foot.
Okay, so doctor, what's the first injury that you report?
So the first injury I report is ecchymosis on the ulnar side of both forearms.
Ecchymosis is E-C-H?
CHIYMOSIS.
On the
On both,
ulnar
on
side
the ulnar side.
Of
Ulnar
what?
side
of?
of both forearms, and I emphasize the left and right.
Doctor, what is ecchymosis?
Ecchymosis is evidence of bleeding and in the soft tissues under the skin, defined by wide patches of darkening. Wide patches of darkening, meaning there's internal bleeding, and if somebody is light,
Slow down.
yeah,
Wide patches of darkening, meaning
Darkening.
there is internal bleeding.
yes, internal bleeding from mainly trauma in this situation that we saw here. And the ecchymosis was characteristically on the ulnar side. Now, let me show you the ulnar side of the arm.
Yes, yes. That's why I was
The
going
arm
next.
has two sides.
So this is internal bleeding.
Yeah, internal bleeding.
Okay.
So this is the part I'm talking about.
Maybe you can explain the
Yes.
part in words.
Yes, we call this the ulnar side in orthopedics because the forearm has two bones. It has the main bone, which is the radius, And then this is called the ulna. So this side becomes the ulnar side, and this becomes the what? The radial side.
So the side you're pointing at is the side from the wrist up to where?
So from here,
That is, here
up
is
to
what?
the elbow.
You know where
This
it's
is the
pointing?
wrist, this is the elbow. So this section here.
So from the wrist to the elbow?
Yes.
It's called the what?
Ulnar side of the forearm. Okay.
So now, what did you observe on the ulnar side of both forearms?
I observed ecchymosis,
Which is internal bleeding.
internal bleeding in the soft tissues.
Okay. The next one?
The next sentence is she sustained fractures of the second and third metacarpal shafts of the left hand. And I'm going to explain what metacarpal is.
Yes. Just repeat it again. She sustained fractures
Of the second and third metacarpal shafts of the left hand. And I'm going to explain second, third, and metacarpal.
Okay.
Because fractures is known probably by everybody. Fracture means a break in the bone.
Fracture is a broken bone.
Yes, a broken bone.
So she had broken bones on the second and third metacarpal shaft of the left hand.
Yes, or left hand. Yes.
Just first demonstrate to us.
Yeah. So this hand has.
You're showing the coat the left hand.
Yes, I'm giving you the anatomy of the. So we say these are fingers, all right?
Yes.
And in the fingers we have phalanges. Those are the bones we have in the fingers. They are usually 3-3.
So just hold on. In the fingers, the bones in the fingers, you have phalanges.
Phalanges, all right, which are supported by bones in the palm.
Okay.
And those are the metacarpals. Those
Okay.
are metacarpals.
Okay.
Yeah. So when we say a break in the shaft, it means in the middle part of these bones. Now, we name them from the thumb.
Okay.
Metacarpal 1, 2, 3, 4, up to 5.
So each finger
Has 5.
has a metacarpal bone.
Yes.
So you name them from the, so the thumb is the first
Is number 1.
is number 1. So the index or trigger finger is number what?
Number 2.
Okay.
Then number 3,
So number 3 is the middle finger.
middle finger. Number 4,
Number 4 is the
the
ring
ring
finger.
finger. Number
Number
5
5 is the
is the
pinky
small.
finger.
Yeah, the small finger. The pink finger, like they call it.
So where is the
So-
here you
so-
talk about
so
the
the
second and
fractures-
third. Okay.
So the fractures were on the second and
Yes.
third metacarpal
Just
on
stop
this
there.
side.
So that is the second metacarpal would be the index or trigger finger.
The index and the middle finger, we call it.
Okay.
We call it the middle finger. This
No,
is
I'm saying this finger,
yeah,
the first finger, the index
the middle
finger, and then the third metacarpal
Yeah.
is the middle finger.
Yes.
And the metacarpal bones in those fingers are broken.
They're broken.
Okay? Is that clear? Okay, let's go to the next thing.
So the next sentence says there was a fracture on the distal ulna, and then the distal fifth metacarpal of the right hand.
Okay, so now we've moved to the right hand. I want to start from the end, then we'll come to the beginning of that sentence. You say there is a fracture on the distal fifth metacarpal. So what's that?
Pardon?
your letter says there's a fracture on the distal, ulna and, so I'm starting from the and. So I want to start from the distal fifth metacarpal.
Okay, distal fifth metacarpal of the right hand, yes.
Yes, so what?
So we've already defined the metacarpals.
Yes.
Yeah. So when we are defining bones, the distal is the one which is away from the head, and the proximal is the one which is near the head.
Okay.
So it is just at the base of this.
At the base of the palm.
Of the
finger.
Of the head. We call it the head, but you can call it the distal part of the metacarpal, of the fifth metacarpal. That's on the right hand side.
So let's first be clear. Are we talking about the pinky finger?
Yes, on the right hand side now. I'm on the right hand side because I'm following what I wrote.
Okay, so on the right hand side.
I'll come to everything, yeah.
Okay, so on the right hand side, maybe just repeat again so we are clear.
So on the right hand side, we've the patient had a fracture of the distal ulna.
Yes.
And the distal fifth metacarpal.
Okay, so there are two fractures, right?
Yeah, those were two fractures.
Maybe let's explain them in the order that you wrote them. So what is a fracture on the distal ulna?
So we say that this is the ulnar bone.
Yes.
The small bone in the forearm.
Yes.
And its distal part again is this one because it's away from the what?
So the distal part,
so near the wrist, the part that is near the wrist, just below its end.
The bone near the wrist.
Yeah. All right.
And that bone was broken.
Was broken.
And then what's the other injury on the right hand?
There was another fracture on the distal part of the fifth
metacarpal.
Yeah.
And just to be clear, the fifth metacarpal represents which finger?
The pinky finger on the right. Here.
Okay, now please go to the next bullet.
So the next bullet, I found the tip of the same pinky finger falling off. You know, it was just falling off from that finger. It had sort of, you know, like a degloving injury that is tearing off the tip of that finger. And I think that is self-explanatory.
Yes.
All right? Yeah.
Yes.
So it was, you know, like a circumferential injury, and the thing is dangling or falling off.
So the finger was dangling.
Yeah. It was that state.
The bit of the finger. The tip. And that's on the right hand.
Yes, on the right hand.
Doctor, now go to the next.
So on the next paragraph or sentence, all the injuries were closed.
Just hold on. All the injuries were
closed.
Okay.
Except there was a gastello 1 fracture of the second metacarpal.
A gastello 1?
Yeah, gastello 1 means that.
First spell it.
Gastello is a classification for open fractures. So gastello 1 fracture of the second metacarpal, and gastello, gastello, it depends on where you come from. It is G-A-S-T-I-L-L-O. It's a semi-classification method.
Okay, so you have a gastello 1 fracture of the second what?
Of the second metacarpal.
On the left hand?
Yeah, on the left hand.
And
the tip of of course, the fifth finger of the right hand, which was, you know, falling off, as
now, Doctor,
described earlier.
Doctor, just explain to us again what you mean by a gastello 1 fracture.
Now, gastello 1 fracture means the wound is less than like a centimeter. It's open, yes, but the wound is less than a centimeter. That's gastello 1.
Just hold on. The wound is open.
Yeah, there's an open wound near the fracture, which is less than a centimeter or less than a centimeter.
Now, doctor, I need to understand when you say open. Do you mean?
Yeah, the bone is exposed under it. The fracture is exposed under it.
So you can see the fracture.
You can see the fracture. Yeah.
You can see the bone.
Yeah.
So when you say all injuries were closed,
Yeah, the rest of the injuries were closed.
so you couldn't see the bone.
The bone, yes.
Okay.
Apart from that one, and
Just hold on, just
and the
hold on.
pink.
For the rest, you couldn't see the bone. Then on the fracture of the second metacarpal, what can you see?
That one, the bone was exposed, where you could see the bone through the wound that was there. The fracture, or the fractured bone through the wound, all right?
And you could also see the bone on the, which other
And
part?
for the fifth finger, because it was degloved, it was coming off. The flap was coming off.
That's the left, that's, sorry, the first gastellar injury is on the second metacarpal of which hand?
That is the left hand.
So, and that would be the middle finger.
The second, no, that is the index finger. Understand?
Oh, that's the index finger.
Yes, I may name them. That is the index finger.
Okay, so we have an open injury on the second, on the index finger.
Yeah.
What is also known as the trigger finger. And the other open fracture you have is on the, you call it degloved. You keep using the term degloved.
Degloving is like the flap, the whole flap is coming off. The skin, the whole skin and the underlying tissues are sort of coming off, and they are just hanging by a little piece of tissue. Okay?
Okay. Please go to the next sentence.
So, she had extensive soft tissue swelling of both hands and the wrist.
She had what? Extensive?
Soft tissue swelling of both the hands and the wrist.
So what does that mean? What's soft tissue swelling?
So usually, most of the swelling goes to we call this one the dorsum of the hand.
Okay.
So it was really swollen.
So the
This
back of
area.
her hand was swollen?
Yeah. Was swollen in both hands.
And what does it mean for the wrists?
Means that they are painful and they are numb. You know, they are painful because it was fresh trauma.
Okay.
And usually that swelling, immediate swelling, usually may be from bleeding or saturation or disruption, okay, from the trauma, or inflammation following trauma. So those are all three possibilities. But usually, because it's so early in the injury cascade, you take more. It's more of swelling of the internal bleeding, right? Yeah.
Okay.
But if it was some days, maybe you can then think about the other differentials.
Okay.
Yeah, because when we get injuries, it's not just the bone that is broken. Usually, the soft tissue is also affected.
So it's not just even the soft tissue.
Yeah, it's usually affected in that manner.
Okay, doctor, kindly take us to the next sentence.
So I assessed the neurovascular status.
What does that mean?
You go to assess the function of the nerves and the saturation
Okay.
in the hands.
Okay.
So we have three nerves that supply the hand.
Okay.
The ulnar nerve, that because we usually do skin assessment from the skin. So the ulnar nerve supplies the one with the small pinky finger and half of this finger. All right?
That's the pinky finger and the ring finger.
Yes, half of the ring finger. So we assess it by assessing from this area, from this pinky finger. Okay? And then we have the second nerve, which is the median nerve that supplies the palm, okay?
Okay.
The palm, right, of this, the remaining fingers. And then on the hind part, then you have the radial nerve. And we have specific areas where we assess from the integrity of those nerves, all right? For the ulnar nerve, we assess from the small finger. And then the median nerve, you can assess it from the anterior of the index finger, all right? Because you want an area where there's no crossover or anything like that. And then for the radial nerve, you assess from the first web, So I assessed and I came to that conclusion that both the nerves and the saturation were still not affected in that regard.
So the nerves were not affected?
Yeah.
Except for?
Except for, the statement is continuing, okay?
Yes.
So hernial vascular status was normal for all the fingers apart from the fifth right finger, okay? The fifth finger on the right hand, which had lost sensation because, of course, of the obvious nature of the injury that was degloving. Because when it's degloving, everything is gone, most likely. But usually I'll come to what I did and the reason why I did it. Okay.
But you're saying but?
You know, I think I will come to that. I let me not interrupt the flow of the report. I'll come to that. So the next statement says that Miss Mele was taken to theater, and after her scalp surgery, ORIF was done of all the fractures. And
so ORIF is just
open reduction and
open reduction?
Yes, and internal fixation.
And internal fixation.
Using pins. These are soft, small K-wires. Because of the nature of the injuries, you don't want to put in heavy metals, which may get affected. So we use soft, not soft, but smooth wires, small wires. This is the small part of the skeleton. And we support them with back slabs. Back slabs. A back slab is something. There are two forms of slabs. You can use either this white one which has even powder on it, or you can use the Dynacast. The Dynacast is the one which is fiberglass. But both do the same thing, but the good thing about Dynacast...
Doctor, you're talking too fast.
I'm talking too fast. Yeah. I'm explaining a back slab.
Okay.
So we can use the white type, which has... which you dip in water and then you put in after dressing the patient, or you can use the Dynacast, which is a little bit, which has no dust on it. You put it in water and then you apply it on top. And in my practice, I use both sometimes because the other one is softer.
In this case, what did you use?
I used, usually I put 2 layers. I put first the plaster of Paris, the white one, and then I add the second layer because the environment is a bit wet and I don't want my slab to be affected. So.
And in this case?
Yeah, pardon?
In this case?
So the main slab that I use is Dynacast. But usually I underline it with what? With a layer of the what? Yeah, in this case I use both. I use both usually.
Okay, now.
My procedure. So you cannot, yeah. So, option. So the other one is just to prevent any kind of pressure points, all right? Because this Dynacast is very hard. It's just plaster of Paris. That's what I.
So there's a plaster of Paris and a Dynacast slab.
Yeah. So usually I use both for the following reason, and I want to explain myself. When you use the...
So explain yourself slowly.
Slowly, yeah. When you use the fiberglass... All right.
I want my
that's how we are taught. I'm sorry. We are not complaining. It's okay.
Okay.
I'm sorry for what I'm not used to.
No. Please
talking
continue,
to
doctor.
honorable courts, but That's why we
No,
usually...
doctor, the comment is that I am also usually too fast.
You're too fast, okay. Okay, I'm sorry.
This is
So
too
this
fast
is
for
what I do, because this is 2 years ago, but this is what I do, and this is what I do for my slabs. Usually, there is the fiberglass, okay, which is usually colored, blue, red, or whatever, and it doesn't have any form of dust. It is very good because it doesn't become soft even when blood or fluids go in it. But it's very also dangerous when you just use it without underlying it with what? The normal plaster of Paris, the one which is white and with powder. So it's a slab, and that's what we did. So when you finish your procedure, you dress the patient with gauze and put cotton padding. So you make that slab and you put it on the patient. And then it dries and hardens so that it supports the pins, okay, the small pins that you use to fix the fractures.
So in short, usually,
That's what I do.
So in short, usually use
Both.
Dynacast and plaster of Paris.
You have to make a slab, to make one slab.
Because?
Because the POP is gentle to the tissues.
POP is what?
Plaster of Paris is gentle to the tissues or the skin, all right? But when it gets wet, it softens immediately. So I underline it on the Dynacast, all right, to form my slabs. So that's what I do with my slabs.
Now, doctor, still on that paragraph, yeah? You say Miss Molly was taken to theatre and after scalp injury, ORIF was done. First of all, I have two questions. The first one, why was it after scalp injury?
I'd explained myself that the scalp injury was more critical or more an emergency because the scalp was bleeding a lot to an extent that she required transfusions even after the surgery. So it was bleeding a lot, and we know this in anatomy. The scalp has so many vessels. Once it opens up, there's a lot of bleeding under the scalp. So we needed to first make sure that she's alive and she's safe from those injuries of the scalp before we handle the what? The other injuries. That's the chronology of how we did the work.
Now, you then say ORIF was done on all fractures with pins and slabs. You've explained pins and slabs, but kindly and very briefly explain to this court what you mean by ORIF.
Okay, so the procedure that we undergo when we are going to do surgery, they are routine things that I don't talk about in the report because it can become so long, but you first assess the injuries, right?
So is that part of the explanation of ORIF?
Yes.
First tell us what ORIF is in full.
Yes, because
first tell us what it is in full.
Open reduction and internal fixation.
So ORIF is open reduction and internal fixation.
Yeah.
And now you're telling us what you do when you're doing ORIF.
Yes, yes. So usually you expose the injured parts, okay? Take off all the dressings. You get copious amounts of antiseptics. All right?
What do you mean by copious amounts? You mean?
A lot of antiseptic solutions. And the solution we use here, that we used is the Savlon.
The what?
It's called Savlon.
Savlon.
Savlon, yes.
Okay.
Or the other name for it is chlorhexidine. But you can go with Savlon, SALVAN.
Okay.
And you clean thoroughly to ensure that there is no foreign particle on the parts that you're going to work on, because...
So just slow down. You clean thoroughly to ensure that there is no what?
Foreign particles on the part you're going to work on or the area you're going to work on. That is the hands, the fingers, the wrist, the forearm. You clean thoroughly up to about the mid-arm, all right? That's what I did.
So that means that there are no, what would be removed from the hands?
Any foreign particle. That's what we use in
any foreign particle would be removed.
Yes. And usually when you finish with chlorhexidine, you can then we do the rinsing, okay?
Okay.
Of the open injuries, to make sure that even more.
What do you rinse with?
We rinse with normal saline. So we rinse the wounds to make sure there is no visible or invisible particle that is left.
There is no visible or
Invisible particles left. And then when we finish to do that, that's when you go to scrub. Scrubbing is when you remove the gloves that you've been applying, and then you are going now to become sterile yourself.
okay.
To work inside on the patient tissues.
Speak into the microphone.
So
scrubbing
after,
is what?
After that thorough cleaning,
Yes.
then you go and scrub. We went and scrubbed, all right, to come and work on the patient. Scrubbing means you scrub your hands and your wrists and your forearm, all right,
Yes.
and then you come and apply drips, which are sterile.
What are drips?
Drips, these are the gowns that we put on in
Okay.
theater. They are usually blue in color and waterproof or blood-proof,
Okay.
because we have to protect ourselves. And from that time, you don't touch anything. And then you glove with the surgical gloves.
Okay.
These are very sterile gloves.
Okay.
So, and after doing that, then you are handed a sterile basin, or we call it a killing dish in our medical term,
Yes.
which has gauze, and they pour there povidone iodine to provide more sterility and cleanliness.
You pour what? You pour what?
They pour povidone iodine.
Dr. Here,
when we start,
Yeah.
you pause.
You pause, okay.
My Lord, is this witness giving us general procedure that he ordinarily does, or is telling this court what he did?
Used sunlight fabric, we clean carrot to ensure there are no foreign particles in the pathway to be attended to. We then scrub ourselves to sterilize ourselves in preparation for attending to the session. Scrub our hands over our arm and then wear the scrub. Then surgical gloves. Then we get a sterile basin in which there is povidone and
My Lord, if God got it like that, then it's okay with us.
Thank you, sir. So,
just for the cover to my colleague, is this what you did?
this is what I did.
Okay.
Yeah.
Continue. So you are telling this court that you have a basin which has a gauze called povidone iodine.
It has gauze, and then we pour the solution called povidone iodine.
Okay.
All right? And somebody assists you to hold the limb, all right,
Okay.
without touching that part, okay, from
Okay.
here, and then you clean thoroughly with that povidone iodine to remove whatever.
Does this court still believe that this witness is testifying what he did, or the general procedure of what he's supposed to be?
That's what I
He
did.
said,
Maybe my language
Don't
is
say then
confused.
we.
Oh, okay,
Say
fine.
then in this
Okay.
case I did
Okay,
this.
all right,
So
but
we are reporting
okay,
what you did in this case.
thank you, my lord. I'm sorry we work as a team, but it's fine. I'm the lead surgeon, but
So
it's okay.
somebody helps you to hold?
Yeah, somebody helps me to hold. That's why I'm
Okay.
using product, but I'm the one who did the work.
my lord, I think maybe just for purposes of clarity, the witness is explaining to us because he wrote that he did RIF, and he's explaining that to
Yeah,
us.
I'm explaining the procedure I did.
Explain it.
To him, yeah, okay.
Yeah.
So then I scrub the patient, all right?
Yes.
Scrub the patient thoroughly on the front part,
Yes.
right, of the all forearm and the hand and fingers, all right, in the webs. I scrubbed the patient to ensure that the whole forearm was painted, okay, before the procedure. And after that,
What do you mean by painted?
Hmm?
What do you mean by painted?
I mean that iodine that we use, it paints to make sure that there is no part that stayed without being touched by the antiseptic. So after doing that, the patient was dripped, right? Both hands were dripped
So what do you mean by dripped?
we call them drips. These are the sterile drips.
Okay.
that we use in theater,
Okay.
that we used in theater at
Okay.
that time. I'm told to be specific. So the patient was draped,
Yes.
and then after draping,
Yes.
that's when I did the procedures I did
Okay.
on her.
And those procedures are the ones which you
Yes.
are the ones of pins and slabs which you had
Yes,
explained earlier.
that's when I did the pinning to make sure that the fractures are in a good position. And then after doing that, I stitched the wounds very well. And then I put dressing, gauze, and then I made the slabs that I was talking about for both arms. I supported the arms with slabs and a bandage on top of the slabs. And then I recommend that the patient goes what? Back to the ICU that night, and then later to the ward. And of course,
Go
the
slow. Go slow. You recommend that she goes to the ICU and then later to the ward.
to the ward, because she was still critical in that first day. And then when she stabilized, then she goes to the ward. And of course,
Just slow down. And of course.
the arms are raised to avoid the swelling continuing.
Okay.
They were raised to avoid them continuing to swell. So then the follow-up was now after that. Yeah, what I explained. Yeah.
So doctor, just clarify one last question on that clinic. Where was it? It was from which part of the hand to which part of the hand, and on which hands?
I clarify what? The
That-
cleaning.
Yes, it was from.
I said everything is cleaned from the tip of the fingers,
Yes.
the palms, the wrist, the forearm, up to the mid-arm. Because you have to go beyond where the injuries appear.
What about the webs?
All the webs, those are the fingers, the whole circumferential part of the fingers and the webs.
And that was for one hand or?
Both hands. Both hands, because they had procedure.
So doctor, then the next paragraph says what?
So the Miss Molle is currently receiving antibiotics and analgesics and is recovering. That was on the 13th of November. And the pins will be removed after 4 weeks. Okay? Usually by that time the bones are joining. We have we know the pathophysiology of fracture healing. So the hand, 4 weeks usually, the fractures are sticky enough to allow the pins to come out. Okay? Can I proceed?
Wait.
Oh.
Maybe let's have a translation.
Yeah, translation.
What was the purpose of all that cleaning?
The purpose of the cleaning is to ensure that there is no visible or invisible foreign material or contamination in the surgical fields before we put pins into the bones. Because if we do
Slow down. Before we put pins.
fix pins into the bones, because if we do that,
Because if we.
we risk the patient getting infection into the bone
Okay, thank you.
and the soft tissues.
Okay. Now, you had read the sentence which says she's receiving antibiotics and analgesics. I think it's clear to us what that means, but could you explain to court what analgesics are?
They are pain killers. They control pain after, if somebody has pain. It's the analgesics that will take away the pain.
Please spell
Analgesics are ANALGESICS. Analgesics. That's the medical term of painkillers.
Can I go to the next paragraph?
So the next paragraph, I say that all injuries over the wrists, arms, hands are pathognomonic of defense injuries.
So just so that all injuries over the wrists, arms, and what else?
Hands are pathognomonic of
Spell that
defense
word.
injuries.
Spell that word.
Patho,
Patho. Yes.
P-A-T-H-O-G-N-O-M-O-N-I-C.
Of
Defense injuries.
defense injuries. So, doctor, can you explain to this court what pathognomic of defense
Yeah.
injuries
Yeah.
means?
Okay. When somebody is facing assault or whatever it is, or somebody trying to hit somebody, the natural reaction is to cover the sensitive or vital parts.
Sorry, when someone is facing...
Is facing somebody and they're trying to hit you.
Yes.
So the natural reaction is to try to what? To cover or defend the what? The sensitive parts.
So the natural reaction is to cover the sensitive parts.
Sensitive parts, depending on where the whatever the assault, whatever, metal or whatever is coming from. And the natural defense position that people take, if you see anybody being assaulted, is to try to hide their face as much as possible, and head. So they try to do this. So you try to hide your face, okay?
Yes.
And usually you do this. And
By that you mean you put your hands over your head?
Yes, of the head, or you try to. They are the ones which try to defend themselves as.
No, doctor, let's first describe that, because remember we are recording. So you put the hands over the head.
The head to try to defend yourself. Right?
Yes.
And you try to hide your what? Your face. That's the natural position.
Okay.
And
So you put, where do you put the hands? Over the head?
You try to defend your head in this
Yes.
position, right?
Okay.
So
and the position, just pause where you are.
Yeah.
Just so the position can be described, that
Yeah.
is hands over the head.
Of the head, yes. This is the position you try to attain. Because somebody is trying to hit and you are doing that. You're doing that. Okay, you're doing that. You're doing that because you don't want him to hit your eyes, you know? So that's the natural defense position. And that's why...
So the natural defense position, doctor, because you were demonstrating just for
I was demonstrating.
the record.
Is
My Lord, practically both the lawyer is testifying, the witness is testifying.
My Lord, that
Yeah.
is an idle objection. Maybe.
so it's getting clarity from me as an expert.
Let him finish what he said and then you ask him.
Much obliged.
So much obliged. So
They take the
So
steps.
when somebody is coming to hit you, you try to avoid him hitting the face because they are sensitive parts like the eyes and whatever. So you usually try to, you do that, all right? Or you do that depending on where
So
the
that is what? Describe that.
So this is a defense position, all right? You try to take a defense position.
So my question is, when you stop there, that is covering your face with your hands.
Yeah, with your hands and your forearm.
That is again what we are
So those are the
opposing.
position.
Please, doctor, allow us
It's okay.
also do our work.
You do your work.
My Lord, let me rephrase the question.
My Lord, what we are
My Lord, I'm going to rephrase the question. I'm conceding. I'm rephrasing the question. My Lord, so, doctor, you have just demonstrated.
Please, we've had this interaction.
Yes.
Let's move quickly
Yes.
and just ask the questions. Let him explain, then you follow up with the answer.
Yes. So, doctor, you have now demonstrated. I want you to reduce that demonstration in words for purposes of us recording it. If someone is to read it, if we are to read it later,
Yeah.
we must be able to.
So when somebody is facing assault, all right?
Okay? I'm speaking to the microphone.
When somebody is facing assault, all right? Assault, the natural thing to do is to protect your sensitive parts, like the eyes, the face. And you try to take away the face, and you bring the arms to try to protect yourself from something hitting your head or something like that. And this is the position that you usually take. And the reason why we call them defense injuries is that these are injuries which are acquired when somebody is trying to what? To defend themselves. And as you note, when you do this,
So these are injuries acquired when someone is what?
trying to protect the sensitive parts of the face.
Okay.
And as you notice, the reason why I call them pathognomonic or very, very, very strongly suggestive of defense injuries is because all the ecchymosis that she had, or the bruises she had, were on this part of the forearm, the ulnar side. And then the hands, which also come in what? In that position, all right? So, that's why I call them defense, pathognomonic of defense injuries.
Because you call them highly suggestive of defensive injuries because the injuries were on there.
Specifically on the ulnar side of the forearm, okay? All right, ulnar side of the forearm and the hands, all right, which usually you put on top of the head as somebody is trying to what? To assault you.
Okay, now. Sorry. Now, doctor, as you worked on her through the surgery, were any photographs taken?
Yes.
Who took them?
Pardon?
Who took the photographs?
The nurse. Because for us as surgeons, we are gloved and we are sterile. But if you want to get a record, and we didn't take this for the media, these are for your own record as a surgeon.
Just slow down. So they were taken under your direction.
Yeah. Because we are two.
My lord.
I took mine for my.
My lord, I withdraw the question. I withdraw the question.
No,
But I withdraw
my
it.
lord, be clear. Actually, we may have my lord to get a print record, probably, before cross-examining this doctor, going by the manner our colleague has chosen to give.
No, my lord, I withdraw that question.
My lord, we kindly request, going forward, we appreciate the withdrawal, but going forward, may Mr. Karunano stop being suggestive. This witness here, we want to hold him accountable for his own words, and we save on the time for cross-exam. Because it is going to be very difficult, my lord, on the record to know which words were put in the witness's mouth and which words came naturally through his personal knowledge.
My lord, I haven't been leading the witness in an illegal manner. I don't accept that. But, my lord, I've withdrawn the last question. Yes. My lord, I want to wind up with this witness very soon. So, you are telling this court doctor about the pictures. Maybe you can repeat.
Yes. In the execution of our duties, we get records. And the records are for the injuries and for the x-rays that we took before and after the surgery. Those are the pictures that we take.
I don't think
And
the mic
they have.
Okay, they have?
So they are available. I don't know what more you want me to.
I want you, doctor, did you see the pictures after that?
Yeah, I saw the pictures.
So who under whose instruction was the nurse taking pictures?
The surgeons,
Okay.
me and my colleague, Dr. Name, for our record purposes.
And doctor, if you are shown these pictures, can you identify them?
Yes, sir.
My lord saw them where?
Okay, much obliged. Much obliged. Where did you see them?
I saw them both after working in theater and even on the ward, because the x-rays, the post-operative x-rays, we take them and the following up of the patient.
About X-rays or pictures?
Pictures.
Pictures, both.
Because he said
I keep records.
in electrical laboratory, the records, we get records, the injuries and the X-rays we took before and after the surgery.
Then counsel is now asking about pictures. So, do they mean X-rays when they refer to pictures
All.
or photographs?
Can I answer? You take photos of all the injuries in your time, okay? And then
No,
you take,
our concern, my lord, is the good doctor referring to photographs as we ordinarily know them, or X-rays?
Then we got records,
records of the injuries and x-rays were taken,
injuries and X-rays.
yeah, we are captured
Before
and after
surgery.
the surgery.
Then he says, I saw the pictures after. Pictures were, the nurse was taking pictures
Yeah.
under our
Instruction.
I
Because-
take it that the references to the pictures,
Pictures.
not the X-rays.
Yeah, so it was now.
Doctor, maybe you can clarify
Yeah,
that point.
let me clarify. So the photos of the injuries and of the x-rays were captured and kept, okay, as a record.
And you, maybe I missed it. Where were you when these pictures were being taken?
Some pictures were taken in the theater because that's when you have the fresh injuries exposed. And then others, we took them after the procedure had been done, a few on the ward.
On the ward.
On the ward, yes,
The ward,
on the ward, yeah. When you are going to change dressings, because that's the few opportunities you have to record the progress of the patient. We have those X-rays.
So the ones which
I mean,
were
those
taken
pictures.
both in the theater and the ward, where were you? Were you there?
Yes, I was there. If you look at the X-rays carefully, they have.
Again, my lord, that is our problem. That is our problem.
So,
The lawyer asks about pictures, the doctor answers X-rays.
Yes, yes. So the photos of X-rays have labels, all right?
photos
Yes.
of the X-rays.
Yes.
You took photos
What?
of the X-rays.
Yes, both X-rays and the injuries. And then I saw the patient and the injuries that she had. I saw the scalp and I saw the hands.
Thank you.
So both, I saw both.
So my lord, maybe let me lead him slower. My lord, with your permission. So doctor, just so we can get it correct,
Yeah.
my lord, you will help me if I am off. My apologies. Doctor, you have photos of the injuries. That means of physical photos that,
Yes.
of who?
Of Mole Katanga, the patient that we managed.
Okay. And then you also have photos of the X-rays, right?
Yes, photos of the X-rays also available. Because X-rays are patient property, you cannot take them away. So you take the photos and you keep the photos
Okay.
for your evidence, for your records.
Okay. And you are telling this court that if you see the photos, you can know they are the ones because you are saying.
I was there in the treatment of the patient and I saw. And even the taking of these photos.
And what did you see? Which injuries did you see? Did you see all the injuries that she had?
Yes, all the injuries that she had on the scalp and on the upper limbs.
So, I want to show you some pictures. I want you to confirm.
We object even before he does. First and foremost, counsel leads him to the taking of pictures. Then he answers that he saw the injuries. If we understood, he saw the injuries. And then he is not clear as to his connectivity with the picture, his nexus with the pictures. Did he see the person taking the pictures? Did he simply see the injuries? Did he see the pictures after they were processed? What did he see, my lord, before things can be put to him? Can the witness be clear? Okay. Because counsel is going through, is going into a technical area that we will need clarity first, even before we raise a legal objection.
Much obliged.
Is he, my lord, what was his role in the taking of these pictures?
Yes, my lord.
In other words, that background is very necessary.
Well, I'll lay that background, although my understanding is the witness has.
Yes. My lord, the witness is not clear.
The nurse was taking pictures under our instructions. Me and Dr. Onen.
Yes.
So some pictures were being taken on his instructions. I suppose the ones being taken on his instructions were the ones of the arms. And the ones of Dr. Onen, of the head, were being taken under Dr. Onen's instructions. Because that was the portion Dr. Onen was under.
And then the $1 million question is, when he said, did you see these pictures? He has not. When he's asked about whether he saw the pictures, he answers, seeing injuries.
My lord, to save time, I can ask.
Not,
my lord, to save time, I can ask that
clear.
question.
My
My lord, I want to save time and ask that question. My lord, if my learned friend could limit his objections, I'm working with him. Doctor may have patience. I want to be quick. Did you see the pictures?
Yes, I saw the pictures.
So you saw the pictures
Yes.
of the
Of all the injuries.
Of all the injuries?
Yes, and X-rays. I saw all the. I have all the pictures.
So, doctor?
Again, my lord, it doesn't end there. He saw them from where, from whom, from what? My lord, it's not cross-examination. This is electronic.
My lord, shouldn't I be protected?
I don't like it, but there is no way around it.
My lord, can I be
We are
protected?
dealing with electronic evidence. And my lord, if Mr. Karuhanga was doing his part, we would not be even wasting this time.
My lord, can I be protected?
But the who, when, where, how, I agree. If it's left out, it can come out in cross-examination.
Yes,
Because
my
he
lord,
has said,
no, my lord, our objection is he can't pass them over.
I'm not passing. I'm not passing them over. I'm
For
still continuing.
identification. Because the reason I'm objecting is when he raises a question, I want to show you these pictures. So he's moving into issues of identification without a proper background. This witness can't identify things without establishing nexus.
My lord, if I can be allowed?
Mr. Morgan,
Yes, my lord.
let me read what I put.
Much obliged, my lord.
Now, the execution of our duties, we gave reports. The injuries and the x-rays, we took pictures of and after that. They are available. I saw the pictures after. The nurse was taking pictures under our instructions. Me and Dr. Onen for the purpose. I saw the pictures after working in theatre, and also the photos of the x-rays and the photos of the injuries and the photos of the x-rays were captured and kept. Some pictures were taken in the theatre and others were taken after the procedures had been done. I was there when the pictures were being taken in the theatre.
Much obliged, my lord.
Is it? No, no. Please.
I'm not obliged.
Let me finish. Then that is where the question was asked and answered. If the pictures are shown to me, I can identify them.
Now, my lord.
I have the photos of the x-ray and I also have the photos of the injuries related to the I would identify the pictures because I was there during the treatment of the patient and I saw all the injuries because I saw the pictures of both the scalp injuries and
So, my lord, from that, what establishes nexus between the taking of the picture, the process of seeing, the medium of seeing? We are dealing with electronic evidence, my lord.
But my lord, this is for cross-examination.
No, no.
My lord, I want to object to this. My lord, really, we should be protected.
were taken
By a third party.
by a nurse.
Then how does he come? How does he come to see them? That is our own
On
issue
the instruction,
of him
he
and
was
his
the
colleague.
one who instructed.
Yes.
And he said, while he was on the ward,
Yes.
he saw
Not going to relax.
So he
We are
saw-
wasting our time.
both after working in the theatre, and I also saw them on the ward.
My lord, by seeing them where pictures are not objects like bottles. They are taken using an electronic device. They can be seen electronically, they can be seen in print form. My lord, there is a reason probably why the defense is not comfortable clearing that area. Because it's a road, can we? No. My lord, they can't clear it by put, I will not be objecting if they are not praying to put photos to this witness.
Mr. Mwagane, defense, let us clear this.
No,
My
my
lord,
lord,
can they first understand our concern so that we save time?
I have understood your concern.
Very good.
Doctor, after the pictures were taken by the nurse, what happened?
my lord, can I say something, my lord?
Let us continue.
Yeah.
No, my lord, for clearing all this mess.
Let the witness.
My lord, allow me, please, my lord, because these documents which you are taking the witness through are already on court record as prosecution exhibits.
So, Mr. Kabila, then there will be no problem with the doctor telling us what. So, doctor, after the nurse took the
we shouldn't
pictures,
even
what
be wasting
happened?
our time.
So,
Maybe, my lord.
No, let him, after the nurse took the pictures, what happened?
so after the nurse taking the pictures, Your Honor, and I've told you the reason why she took the pictures, because we are gloved and we cannot take them in some situations. She showed me the pictures on her phone, and then I told her to share them with me on my phone, and she shared them with me, and I have them.
Doctor, did you also see printed pictures?
May I have the ones on the?
But
on
did
the
you see printed pictures as well?
No. I've not seen the printed pictures as yet. I saw the ones that I took through my nurse.
So if you're shown printed pictures, can you confirm if they're the ones
My
you
lord,
have?
Yes.
I know. My lord,
My lord, can I be
this
protested?
court has
Just a
heard
moment,
that.
I am still recording what happened.
Yes.
After the nurse took the pictures, she showed me the pictures on my phone and she
On her phone and shared
them
with me.
with me on my phone. Then,
So I have the pictures with me.
on your phone.
Even I have them on my phone.
Then, you did not see any printed pictures.
No, I've not seen the printed pictures.
But if the pictures, if printed pictures are shown to you, can you confirm if they're the ones you have?
My lord, that
Yes.
in digital terms.
My lord, I'm not asking
and
my
my lord,
digital
we are
question.
ready- We are ready to traverse that road. My lord, if a witness did not see
My lord,
anything in
my lord,
print,
Mr. No, my lord, before you interrupt, Mr. Mwagane.
Let's see what
Yes,
you
yes.
said, then you respond.
Yes.
What are you asking? No, you're not asking the question, but
Yes.
what,
My lord.
what is your
My Lord, I'm asking for protection. I'm asking the witness a question. My Lord, it is easy to see a photograph and know if it is the one that you have. If you want me to lay that background, I can also lay it. Whether you can see a photograph.
Who printed? You said, so
No, I'm not asking about who
how
printed.
did you get them?
My Lord, I don't intend to tender them. I don't intend to tender them.
Don't go there.
Don't worry about what I'm going to do. My Lord, if I can be allowed, I will not tender. My Lord, the objections of my colleague will come at the point of tendering. Let me lead my witness. If what I say is not tendered on the record, it is fine. Let me lead, and then we shall deal with legal objections when I make a legal prayer for tendering.
My Lord, our objection is exactly not...
My Lord,
at
is that
not
inappropriate?
at the point of tendering.
Just let's hear.
We are not objecting to the tendering. We are not yet there. We are objecting to asking a witness to identify a subject that a witness says he clearly has never seen. This witness has never seen any printed pictures. Now, counsel is asking him if he can identify some printed pictures. My Lord, he cannot.
My Lord, my
The
question,
witness cannot.
my Lord, my question is simply, no, Mr. Morgana, you do not distort my question. My question is whether
He can identify.
the printed pictures are the ones he has, whether what he has, what I'm going to show him is a correct reflection of what he has.
And we are objecting because this is not the right witness to do that. My Lord, unless...
My Lord, he's the one who has them.
My Lord, can we...
Let us have a formal objection so that we can.
Let him put his formal question, my Lord, then we can formally.
So, my Lord, I just want to record that my learned friend doesn't know what he's objecting to. My Lord, let him make his objection.
Because it's been objective.
My Lord, what did Mr. Karwanda ask?
You don't know.
What's the objection?
He prays to have the witness compare printed,
My Lord,
which he didn't see, with the soft copies that he had.
yes. That Mr. Mwaganya tendered in, my Lord. Yes. Yes. Yes.
Who is providing that?
And there are prosecution exhibits.
No, my Lord, can we avoid this?
My Lord, the prosecution shouldn't be allowed to suppress evidence.
This kind of. My Lord, can we keep our calm?
It's you who has KATANGA circular show.
We are objecting, my Lord, to the defense attempts. To invite this witness to make comparison of some alleged printed pictures with what he alleges to have on his phone. My Lord, we are using alleged on purpose because, one, this witness has not been led into tendering.
No, my Lord, I want to object. My Lord, my learned friend raising an objection should cite a law and go into his objection. My Lord, I want to object. This is not a submission.
Mr. Karwanga, let him
No, my Lord, my prayer is let him go to the law. Let him go to the law.
go to your objection and then
Yes, but no, my Lord, what I'm objecting to is setting a background, brief facts, submissions. My Lord, let him go to the law of his objection.
Mr. Morgan.
My Lord, can he cite the law which prevents me from doing exactly what I'm doing?
Mr. Morgan.
He
I
wants
can't.
the law, my Lord.
I can.
Proceed with your
My Lord,
objection and
yes.
then
But my lord, it should be succinct and to the point and to the...
Someone can proceed.
Yes.
But with the law.
Let us get quickly to the practice of the.
My lord, where did I stop before I was?
The prosecution of just the defense attempts to invite the witness to make comparison of some alleged witness pictures with what he alleges to have. The prosecution is using the term alleged because the witness
Has not been led to first tendering what he has, what he says he has on his phone. Is unknown on record. Secondly, my lord, issues of comparison of electronic evidence can only be done by persons that are specifically trained to do the said comparison. My lord, no evidence has been laid that Dr. Sechem, in addition to being what he says he is, that he also possesses expertise in photographic analysis or comparison. But third, my lord, the witness has been clear. He has never seen any printed photograph. His knowledge is can only be restricted to what he electronically has on his phone. My lord, the provisions of the Electronic Transactions Act, let me pull it up. Section 8. Yes, the revised one. The battery is running low.
It is the one we quoted last time, and
let me just pull it out, my lord.
the section we quoted.
Yeah, this should be the revised one, my lord, because the section was previously second. So subsection, my lord, section 8 deals with admissibility and the essential weight of data messages or electronic records. My lord, under section 2, a person seeking to introduce Section 8.2, the person seeking to introduce a data message or an electronic record in legal proceedings has the burden of proving its authenticity by evidence capable of supporting a finding that the electronic record is what the person claims to be. And my lord, in the same act, the test is to such witness must not just prove originality or authenticity but reliability. My Lord, when the law says a person seeking to introduce, my Lord, introducing is not at the point of tendering. Introducing is at the point of raising the issue. So, my Lord, the moment a question is raised as to any electronic message, data message, in this case, my Lord, the photographs tendered, the photographs taken, then the rules set out in the Act must be immediately complied with. My Lord, number 4, this objection has a basis at the commencement of the defense case. We went on record, my Lord, requiring, my Lord, electronic copies, soft copies, my Lord, of the pictures alleged to have been taken of A1. My Lord, we are on record. Those soft copies, my Lord, have never been availed. Now we know that they exist. But the person who has them, who has admitted on record to having them, my Lord, is not being led to tendering them, but he is being invited, my Lord, to look at other materials that he has never seen before, the printed pictures, and to tell this court that they rhyme with what he purports to have. The witness doesn't possess, at least he has not been led to prove that he possesses such skills of comparison, but also, my Lord, he cannot purport to compare any material with, any materials that he has never seen before with what he claims to have, and it is still in his pocket. It's not on record. That is why we object.
My Lord, I just want to very briefly reply to the very lengthy speech of my learned friend. My Lord, I'm responding. Can I not be blocked from? Can I not be blocked? No.
I have taken it. I have taken it regularly, my Lord. Can he just refrain?
Yes, my Lord.
KATANGA proceed.
Yeah, much obliged.
Mr. KATANGA, please refrain from making statements of that nature. If you call someone's submission a speech.
Much obliged. My Lord, maybe let me edit. My Lord, I wish to respond to the very lengthy submissions that my learned friend made in speech form. Ended by citing the electronic Transactions Act, Section 8 of which deals with admissibility. So his objection is premature. Section 8 of everything he has quoted, my lord, is to do with admissibility. He has not cited a single law barring comparison. My lord, as you know, as is on the record on this court, comparison has already happened in this court between WhatsApp messages and printed documentation, even for purposes of admissibility. My lord, the second thing, Section 8 deals with two things. One is admissibility, the other is evidential weight. The attempt to block this witness from answering the question deals neither with admissibility nor weight. It is simply a bold attempt at evidence suppression. In this case, my lord, the evidence has already been admitted by the prosecution. I want him to confirm if what the prosecution brought to court is what he observed. So if it means I rephrase the question to say, this was brought by the prosecution, is it what you observed?
What the defense is to do is to have the witness.
Just compare evidence brought by the prosecution and confirm whether or not their evidence reflects what he saw. As a person who was there, my learned friend did not bring an electronic message to this court. Nor did he tender in those photographs. My learned friend, my lord, I'm asking this witness to look at a prosecution exhibit.
The prosecution did not tender any.
They did bring an electronic message. I am simply saying this is what prosecution has brought to court. Is this what you saw? If he didn't want it to be before the court, he shouldn't have brought it. And my lord, the record will reflect that in bringing it, he made another very lengthy submission. So my lord, issues of electronic messages is a very premature objection. I will come to electronic after I have dealt with his own exhibit. Much obliged. So my lord, basically, I am not praying to tender any electronic record yet. His section that he has quoted is dealing with admissibility. I am simply asking him to compare prosecution evidence that is already on court record. And my lord, the point I want to make is the justice of this point is that this evidence is already before my lord. It's important to know if that evidence is a true reflection of the facts. That is, this is a fact-finding court. I will then, after that, my lord, seek to tender in the electronic record and respond to his electronic points.
Yes, to address you, because that is a misrepresentation, my lord.
My lord, if it's a
my lord,
lord,
what is in evidence already?
my lord, I am
Seeking to have the witness look at
a prosecution exhibit.
Which one, my lord?
Yes,
Which one, my lord?
prosecution exhibit 121.
an exhibit that was tendered during cross-examination of A1. It is, we were holding her to strict proof of what she had alleged. It is evidence that, her own evidence, my lord, of what she had previously relied on. It is not prosecution evidence.
My lord, what
It
is
is-
it?
It is a prosecution exhibit, but it was not prosecution evidence. My lord. Can I?
But it's already, but my lord, it's not.
Mr. Karwanga,
Yes.
Evidence is on the record.
Yes, my lord.
It is on record, but what Mr. Karwanga is misrepresenting is that it is on record as prosecution evidence.
As a prosecution exhibit.
Okay? My lord, these are materials that prosecution tendered, materials forming part of what the accused person had previously adduced, alleged, and brought forward.
Yes, but they are marked PE.
They are marked as prosecution
They
exhibit.
are part of what
Yes.
you tendered.
They are marked as what
And
we
they were
tendered.
received on the record through you.
Yes. Yes.
So, to that extent,
They are received
Yes, ma'am.
on record, my lord,
Yes.
through the accused
the
person
accused person, yes, but
They become live.
during
during
cross-examination.
your
Yes.
post-conviction trial.
So it is a court exhibit
Yes.
tendered by prosecution,
Yes, but it's already on
not
the
as a
record.
prosecution exhibit.
No.
but evidence.
My lord,
No,
My lord,
but my lord, that's now semantics.
now, as
Okay.
far as,
Can I finish, my lord?
But you need a given.
I thought you had finished.
Yes.
No.
Because there was a misrepresentation.
There is a misrepresentation that the photographs that we tendered, by the way, we tendered them as adverse evidence. We never laid them as prosecution evidence.
That can
We
be
tendered
addressed,
them
that can be
as
addressed
adverse
at the
evidence.
time of submission.
So
Yes.
it-
Natural
yes,
blight.
yes.
That can be
So
addressed at the time of submission.
now, what Mr. Karwanga is misrepresenting is that we are objecting to tendering. No, we are objecting to introducing.
No.
And the law, my lord, doesn't talk about tendering. Subsection 2 talks about introducing. A person seeking to introduce.
Introduce where?
Not tendering.
And
The
we are not
procedure has-
introducing.
in other words, my lord, if you intend to introduce that subject and traverse it for whatever purpose,
No, my lord, I really want to object
Why?
to my lord,
In a person seeking to introduce
in evidence.
a data message
In
or an electronic record in legal proceedings has
Yes.
a burden of proving its authenticity by evidence capable of supporting a finding that the electronic record is what the person claims it is.
Yes, my lord.
Subject to
So, my lord, I'm not introducing an electronic record, just for the record, my lord. And what I'm asking the witness to do,
When asking, remember that there is also, when assessing the evidential weight of a data message or an electronic record, the court shall have regard to the reliability of the manner in which the data message was generated, stored or communicated, the reliability of the manner in which the authenticity of the data message was maintained, the manner in which the originator. It's an electronic record.
my lord, it is his own. Prosecution Exhibit 121 is not a data record.
No, what he has.
Yes, I'll come to what he has, which is the second question. Yes,
what it is seeking
So I think
to
what-
compare with.
What,
my lord,
what the witness can do
my
in
lord,
respect of those pictures,
on his phone,
which, not on his phone, on those ones that are
in court. Yes.
what he can do is to,
Printed
that is what he
images.
said. So
Yes.
let us hear it from him.
Yes.
Have you ever seen them
No,
before?
let him tell
Ma-
us.
ma-
Let us read him there. I know where
Yes.
he's going.
Yes.
Let him,
My lord,
so let
and-
him answer.
but my lord, before that, I really want to object to the practice.
Has he seen those pictures
Before.
Those
Okay,
ones.
look at those pictures and tell us. Listen to my question carefully. Do they reflect what you saw, and have you seen them before?
No, have you seen those hard copies before that you have?
Yes. In any form.
Have you seen those? No. Have you seen those
Hard
things
copies.
printed out before?
Yes, doctor.
these are the very pictures.
My lord, my lord, no.
Yeah, it's fine, it's fine.
No, don't threaten the witness. My lord, he's threatening the witness. My lord, he's threatening the
I
witness.
didn't know that.
My lord, can I say something? No, Mr. No. My lord, I pray. No. My lord, our witness is being threatened by a state attorney. My lord, no. Don't threaten people. You have no such right.
You are all, you are a lawyer, we are with you.
My lord, he has no right. And my lord, I pray for protection. Shouting at the witness and threatening him. No. My lord, let me speak. My lord, let me speak. My lord.
You are the one